Hello, everyone. I'm Colleen Acunzo, Dr. Beth Collins, Practice Manager. We're going to begin the webinar in about 5 minutes. I'm sorry, we had a little technical difficulty. Hello, everyone.
You're good now.
Few technical difficulties. I'm Colleen Acunzo, and we're still having technical difficulties. Let me go in the other room. Hello, everyone. I'm Colleen Acunzo, Dr. Beth Collins, Practice Manager. We're going to begin the webinar in about 5 minutes. I'm going to have a few housekeeping items at that time, so stay tuned.
Okay.
Hello, everyone. We are now ready to begin the webinar. First, just a few housekeeping items. On the right side of your screen, there should be a dialog box. In this box, there's a question and answer section. Throughout the webinar, everyone will be on mute. So if you have any questions, please use this dialog box to type in your questions. At the end of the webinar, Dr. Collins will answer as many questions as we have time. This webinar will last approximately 30 minutes. Don't worry if she doesn't get to your questions, she will email you a response. Please be aware that we are recording this webinar and a copy will be posted on our website at www.bethcollinsmd.com. I'd like to tell you a little bit about Dr. Collins. She's a double board certified plastic surgeon, practices in Guilford, Connecticut. After graduating from medical school, ranking 10th in her class of more than 200 students, Dr. Collins completed a general residency surgery at East Carolina University Brody School of Medicine in North Carolina. After obtaining board certification in general surgery, Dr. Collins completed her plastic surgery residency at Emory University in Atlanta, Georgia, one of the nation's top plastic surgery residency programs. There, she was fortunate to train under some of the most recognized names in plastic surgery, further honing her skills before pursuing private practice. I'd like to introduce Dr. Beth Collins.
Well, thank you, Colleen. That's very kind. And I hope you all could see me here from the webinar. Thanks to everybody who signed in. It looks like we have about 45, 50 people, and the people keep coming. And thank you to those of you out on Instagram. On Instagram, you may not see my slides, but you can tune in later on and get a copy of the webinar and see what pictures we're looking at if you can't see them from Instagram world. So today I have a very limited time to talk to you a little bit about facial aging and what we could do to repair some of the changes that happen naturally with aging and prevent some of them. So here we go. I put together some slides, and it's no way a comprehensive view of everything that we could do, but it'll give you an idea of what we have to offer. And then at the end, we're going to be offering some specials that will be going on for the rest of the week. If you call in during the rest of the week, these will be open and available to you. So you could listen right now and take your time and then call in later. And there are people there to answer any questions. So here we go. How do we advance? So hold on just a second, a little technical issue. So what I want to start with is tell you a little bit about the facial aging process. There are 4 things that happen as you age. 3 of them we could do something about, and here comes Franny's going to help me to advance the slide. So the button's not working here. Oh, that one. Sorry, everybody. There we go. There we go. So there are 4 aspects of facial aging. 3 of them we could do something about, and 1 of them we can't. Those 4 things are skeletal reabsorption. Your bony skeleton, your face actually diminishes as you get older. There are skin changes that happen. There are tone changes, meaning age spots, red broken blood vessels, which we call telangiectasia. And then texture changes. You may notice that you have fine lines and wrinkles. Your pore size may be increasing. You may have a rough texture of the skin. And some people say, I have these barnacles on my face. They're called seborrheic keratoses. All these things happen with sun exposure and somewhat due to genetic factors. In addition to skin changes, we have volume loss in our face and also tissue position that changes. So as we go through, I'll talk about each of these things in turn. Skeletal reabsorption is something that within the world of plastic surgery, it's a very specialized field. In general, we can't do much about it. The one thing and bit of advice that I would give you is take very good care of your dental health, because keeping your teeth is very important. People who lose their teeth, especially in the back, will find the caving in of the cheeks and lower portion of their face. So that's something that you could do to be proactive about that. So keep up with your dental hygiene, get your cleanings every 6 months, and make sure you're keeping up with those important health things. It's also very good for your health overall. Aside from that, the things that I can do to help you is help you with the other 3 aspects of facial aging. So I'm going to talk first a little bit about skin changes that happen. And this I put a lot in the preventive column of facial aging, but then there's also some reparative things that we can do. And that's going to be a combination of really an investment of your time to really keep up the health of your skin and do things on a daily basis, as well as maybe even a monthly basis to beat back. And I always describe it as weeds. You could do one thing to weed your garden, but in 2 weeks, the weeds are going to be back. You have to have a continuous relationship with your skincare to really prevent the changes that are happening that are going to ultimately lead to unhealthy looking skin and aged appearance of the skin. Some of those things are spa facials. We could do chemical peels and things like that, which will really treat the surface of your skin and help with the texture and tone of your skin. Other things we have to offer are laser treatments. In my practice, I have a Cyton laser, which is a wonderful tool for me, one of the best things that I added to my practice to help my patients with their skin aging. Broadband light and photofacial treatments are going to help with tonal changes of your skin, brown pigment and age spots, the damage that the sun does to your skin. People with rosacea and red pigment in their skin could be really changed and helped by these kinds of treatments. The other part of the laser is a resurfacing laser, and that's where we could treat the signs of fine lines and wrinkles. We could firm up the skin and cause it to contract a little bit, helping with some of the sagging within reason. And some of the different procedures that I have in my office are nano peel, micro laser peels, and then deep resurfacing peels. And I'll show you in a minute some pictures of those things so you could tell what the difference is. And I'll talk a little bit more about the downtime and recovery of each. The other is a halo laser, which is a fractionated form of this, and I'll talk a little bit more about that. In addition to that, you always have to be thinking of your home care, and I would tell you that any prescription grade health home care skin care is going to be better than anything that you could get at a drugstore or a cosmetic counter. So I know people will go out to the Clinique counter and they'll spend hundreds of dollars on a skin cream that really isn't penetrating the skin. It really isn't having any major effect to the actual histology of the skin. When you're talking about good home care and good home skin care, those things are going to penetrate deep and really affect very good change and help you with the health of your skin. And then finally, sunscreen is the king. Even in the winter months, we're coming into the fall when laser treatments are going to be more popular. You want to really have a good home care regimen. So let's first talk about broadband light photofacials. These are a visible spectrum of the light that we could filter down into one wavelength. And what those one wavelengths will do is they'll target different pigments in your skin. So if we put a filter in for somebody who has, say, these brown spots on their skin, we could get results like you're seeing in the first picture to the left side of your screen, where this person had one treatment with a broadband light photofacial to really target those brown pigmentation. You know, this treatment can be augmented by certain fade creams and retinol derived creams that you use as your home care regimen to not only correct age spots that you have, but also prevent new ones from coming. And with the added benefit of actually changing the genetic makeup of your skin to keep your skin looking younger as you are going through the aging process. To the right side of the screen, that's a different filter put on the same laser that is targeting red pigments at the base of your skin. And this man had more than one treatment. He underwent 5 treatments to get that result. And the point is that it will eventually beat back those pigments that are in the skin, causing an aged appearance. And then once we get that treatment completely solidified and you've gotten to your end result, we come back at intervals, maybe quarterly, to beat it back and to just give a touch up so that you don't ever end up back to the original form and you just keep on with the maintenance program. This next slide shows an example of a Nano Peel. This is our other type of resurfacing laser at its most superficial setting. The difference between this laser and the laser I just showed you is it's not targeting necessarily the pigments. It will do a little bit for the pigments at the very surface of the skin, but this laser is more geared toward the texture of your skin. You'll see in these examples that you have a generalized tightening of the skin and even a reduction in some of the fine lines and wrinkles. With this form of laser, the downtime of it is minimal. Nano peels and micro laser peels only do the top layer of your skin, and you're looking at, in the case of a nano peel, almost no downtime. You could have this procedure and the next night be out to dinner with your friends. You might have a little light peeling. As we go deeper in the micro laser peels, we're going down deeper into the skin, and we could target more fine lines and wrinkles, deeper skin. You're going to get a little bit more of a wow factor, but a little bit more downtime. The nice thing about the Cyton laser is it's completely tunable, which means that I could set the depth of treatment to anything I want. And in these next cases that I'm showing on the screen right now, I peeled very, very deeply into the skin and could really, it's almost like, I like to think of this as closest to a miracle that I deliver, and it's almost like surgery of the skin. In this particular laser that I'm doing, the downtime is more significant than the first two that I just mentioned, the nano peel and the micro laser peel, but these results speak for themselves. We could really reverse any of the sun damage that's done to the skin, even through the years. In that top example, this lady had cataract surgery and didn't really know that she had this, the depth of wrinkles around her mouth. But you see that with just one treatment, she had a complete reversal of all of those age changes. Now, she had about 10 days of downtime with this and then some redness that persisted for a while. The same thing is true for the lady underneath her with the what she called barnacles on her face. She had one treatment to get this result, and you could see a reduction not only in the brown pigmentation and the textural changes of her skin, but you could also see that her wrinkles around her eyes are improved. And then if we added a little bit of Botox and potentially some filler, it would really reverse the changes. She's 1 month out, and you might notice that she still has some red that is slowly going away, easily covered with makeup. But this is a full field ablative laser. Same thing, this is something that people often come to me for the smoker's lines around their mouth, and it is the best, in my estimation, the best treatment of the smoker's lines. People come in and they want filler sometimes. I will try to steer them toward laser treatment of those, because I think often if you try and fill with filler those lines up here, you can sometimes get a thickened appearance up there, which is not the greatest. And oftentimes I'm doing some sort of balance between a little bit of light filler here for the deeper wrinkles, but then I like to come back and resurface that area of the skin to make it smooth. And you could see the results really do speak for themselves. I should also mention that if you don't have the time for this deep peel ablative laser, the first two that I had mentioned, the nano peel and micro laser peel, are cumulative. So if we do 10 of them, that's going to have the same effect as one of these with not that prolonged downtime. So you can make an appointment with me, and we could talk about what treatment's best for you, will fit your lifestyle, will achieve the goals that you want. And all of those things are very personal for each person. It's impossible to put everybody in the same bucket. This is another form of the same laser called the halo laser. Now this is different in that the lasers that I just told you about are full field ablative laser. You could think of them as like sandpapering down the skin, and they have a lot more downtime. This laser is the same technology, but instead of a full field ablation of the skin, it makes little channels in the skin. So it leaves intervals of normal skin in between. And what that means for you is that you have that same collagen stimulation, you have that same ablative nature of the skin that will force collagen formation and help with the fine lines and wrinkles, help with the texture, and it will also get deep enough to help with some of those pigment problems too, but it does not have the same amount of downtime. And the reason for that is that you have islands of normal skin to repopulate. So reliably with the halo laser, we see approximately 4 to 5 days of downtime. About 10% of people will swell with this treatment, and sometimes we treat them with steroids, but for your first treatment, I would say give yourself about 4 days after the treatment to see how you react. And you may even be somebody who doesn't react with swelling, and you may feel perfectly comfortable going to work even a day after this treatment. But the results are beautiful with this. It's my chosen laser for some dyschromia that I have, and it's my plan for my own skin to keep the collagen stimulated so I don't develop the fine lines and wrinkles. That and my home care of retinol is how I keep my skin healthy and reverse some of the sun damage that inevitably happens in our shoreline community on the beach. Another part of laser is that we can combine these two lasers. Now, I just spoke to you at the beginning of broadband light laser, which targets the pigments in your skin. And then I told you about resurfacing lasers, which target the textural problems in your skin. So what if you have both? Well, the good news is that you can combine those two lasers and do them in the same setting. And here's an example of a man who had a broadband light photofacial, which targeted these brown dyschromia age spots in his skin, and then came back in the same setting and did a halo laser on top of that to help with the textural problems that he had. And he had just a beautiful result with that. This is the same situation where somebody had the combination of a broadband light photofacial for the brown pigment in her lower cheek area, as well as then a halo laser treatment, which helped with the textural problems. So that concludes a little bit about the volume, or a little bit about the laser portion of the practice. And certainly that is a very light overview of everything we have to offer, and it would take coming in and having a chat with either myself or one of my nurses about where we could fit you into a plan that's going to be tailored to your specific needs. So let's move on to the next part of facial aging, which is volume loss. So what happens as you get older, you have fat pads in your cheeks. When we're babies, they're held up in position that makes a smooth transition from the lower eyelid into the cheek. So a smooth lid cheek junction where you don't see hollowing under your eyes. You don't see the sag of the fat pads coming down and giving you deep folds here and then gels. Part of that is positional changes of the fat as they descend, as the tissue sags. But another part of it is that you actually have atrophy of the fat. Your fat pads actually get smaller as you get older. So one part of correcting facial aging is to replace that volume. Another part is to change tissue position, which I'll get into next. But first I want to focus on the volume loss that happens, because we could treat that either with surgery, or we could treat it with minimally invasive injectable fillers and things like that. So getting into some of the people who have come in who have only had volume replacement, and in some cases were people that I gave advice to get surgery, but when we came in and really replaced their volume, it's surprising how you could reverse even some of the tissue changes, the tissue position changes that happen as the volume is lost. Because as you restore the volume in the cheek, if you put it back in the physiologic position where it's supposed to be, you will often see that people have a repositioning of the tissues and a correction of some of the sagging that happens. So in this patient, she had what I would call a liquid facelift, where we just put the volume back in where it's lost, which is often along the cheek and in the under eye area. She had a tear trough injection, which I do, and then a little subtle amount of filler into the nasolabial folds, and what you'll notice is it's softened up the junction between the lid and the cheek, and she doesn't look like she has those bags under her eyes anymore. The nasolabial folds, even though they're still there, they don't look quite as deep because the balance has been restored just with some injections. And in her case, I used a hyaluronic acid filler, which is a commercially available filler. It's inert. It doesn't have any proteins or any possibility of allergic reactions to it, or very rarely would have the possibility of allergic reaction to it. It is a temporary filler in that it'll last 1 to 2 years. Oftentimes people will come in and get what I call a liquid facelift. They'll get a complete correction of all the volume loss that they have, and then they'll come in every 6 months to a year to just get a touch-up where they would need much less than they did at the initial push. In this person's case, she had the full correction, and then she'll come back in once a year and maybe get 1 or 2 syringes to kind of top it up and keep it looking better. Even in the case of people who are a little bit younger, we have genetic predisposition to a flattening in the malar region or the cheek area. And in this case, this person had just a little hollowing under her eyes, this beautiful girl. We put just a little bit of filler along the cheek line and softened that hollowing under her eyes just to make that a little bit less noticeable. In this patient's case, we did combine some volume therapy into the cheek area, and you'll notice her upper eyelids look better. She had combination treatment of an upper eyelid blepharoplasty with some volume into her cheeks, and I actually did do a laser to resurface her skin. So when you add all of these procedures done at the same time, what we do all does work in concert. You treat one thing, sometimes the other thing doesn't look so great. So sometimes adding a couple of procedures together will get you the most natural look. It's kind of, I joke around, sometimes you renovate your kitchen, all of a sudden your bathroom doesn't look good. It's sort of the same situation, but when we do these things in concert, we really get a nice, very natural result. And here she is from the side. You could see the rounding of her cheek from this corner, where if you look at a baby or a youthful cheek, it's rounded, and from this angle. And I'm always, you'll see when I'm doing these injections, I'm looking at you from all angles. I'm making you smile and move to make sure that you don't have any awkward movements, and people really shouldn't be able to tell that you've done anything. They just should know that you look better, you look fresher, more rested, and that's the goal we're looking for. I don't want to change the way you look. I just want you to look the freshest and youngest you can at the age you are. So the other missing piece now is tissue position. So now we've gone through skin changes, we've gone through volume loss, and the other major one is tissue position. As we all know, gravity is not really our friend when it comes to facial aging, and you start to see the ligaments that support those fat structures and keep the skin tight start to loosen. They lose their elasticity. They don't spring back as well, and you see that you have the sagging and the typical signs of an aging face. When I'm looking at the aging face, I look in the thirds. I look at the upper third, which includes your brow and your upper lid, the middle third, which is your mid face and lower lid, your cheek region and lower lid, and then your lower face, which is your jawline and neck, which we want to restore the beautiful normal. In my opinion and in my hands, using surgery for tissue position is the best way. I don't know really of any device that's going to give you any magical fix for these things. In certain people who have minimal changes, sometimes we can do it with minimally invasive things, and that's a discussion we have to have together. I have to come up with a plan. I can't give a generalized rule of thumb. It's very individualized. In this person's situation that you're looking at here, she had a lot. We're looking at upper third and mid third changes that were contributing to an aged appearance in her skin. She came in and had an upper and lower lid blepharoplasty and some volume reestablishment of her cheek to get this result. So she did not have a facelift, so she still has a little laxity in the lower portion of her face and neck, but with just fixing the upper and middle third of her face, you could see a real big transformation in her particular case. And we actually came back at a later date and did a resurfacing laser on her, which is fully documented in a video on my website if anybody was interested in seeing that. This interesting case is the same thing of a person who complained of the upper third and middle third of her face she felt was aged. She didn't like the bags under her eyes. So I did a upper and lower lid blepharoplasty on her with some fat grafting into her cheek to add volume. And this was her result, and she came back and I showed her these pictures of her before and after, and she looked at it and she said, oh, I don't like my neck anymore. So we came back and in a second surgical procedure, came back and did a lower face and neck lift, which is corrective of this portion of the face and above. And here is her final result after a 4-lid blepharoplasty, lower face and neck lift, and some fat grafting into the cheek region. And there she is from the side. You could see a sharpening of the jawline, a correction of the position of all the tissues in the midface. Even young people, this girl who is in her 30s lost quite a bit of weight with great diet and exercise, and she felt that she was seeing a hollowing under her eyes with some lines down the cheeks that she didn't like, and she even noticed down here that she had some jowling. So she very wisely came in and had a facelift, and we did a lot of volume replacement using fat grafts in her case. And here is her result with just a beautiful natural look. And now she looks more her age and could really enjoy the benefits of all that weight loss. Now here's somebody moving down to the lower registers of facial aging, where you see that there's a laxity in the neck. You could see some platysmal banding, which are these lines that are going here. She didn't like the gels and the fact that the neck was kind of blending into the lower face line. She wanted a sharper jawline. She wanted her neck to be tighter. And then when I was looking at her, I noticed that she had a little upper lid redundancy. And something that I really love as a procedure is the shortening of the upper lip, which I did in her case as well. Because as you get older, the upper lip gets longer, and you could see that the pink of your lip starts to disappear and almost get swallowed up into your mouth. Just doing a gull wing takeout of the upper lip to lift it will not only evert the lip and give you a very subtle but natural looking augmentation to the lip without any filler at all, but it shortens the upper lip and really gives a beautiful balance to the face. So this lady underwent an upper lid blepharoplasty, lower face and neck lift, and a lip lift for this beautiful final result. And there she is from the side. You could see an upturning of the upper lip, and you could see a sharpening of the jawline, correction of the jowling, and a nice result with the contour of her neck. And this is kind of my favorite shot when people are looking down. You could see that the skin is no longer redundant and hanging, and just sharper for her. This lady also underwent lower face and neck lift with some fat grafting into her mid face with quite a beautiful sharpening of the jawline, a definition that just gives such a beautiful and youthful appearance. Really happy result there. Again, much the same. And I like to, if somebody's coming in with a mixture of problems for me, like they have the positional tissue, they're complaining of jowling and extra skin on their neck, and they've lost volume in here. A lot of times people will come and they want me to fix it just with a shot of filler. And my advice to you in those situations is, if you have positional problems and you're somebody who would be amenable to a surgical procedure, I think the most natural way of getting, or the best way and most effective way of getting a natural look to the correction is to fix your positional issues first before you add the volume. You might see people out in the media now who look like flotation devices because they've just been blown up with volume. Those are people, I think, who have tried to correct their positional problems by blowing up and correcting only the volume problem. How does this happen? I think they go to people who don't have that tool, or like they go to somebody who's a non-surgeon, so they don't have the tool to do the facelift and positional changes, and they get filled up with volume instead, and that's a mistake. So we are changing the position of the tissues first, then adding volume, And that's when you get these better results, sharper jawline, more natural outcome. And I'm going to speed through the rest of this because we are running out of time. And I just want to show you some examples of, these are all lower facelifts with subtle volume replacement. You can see I've replaced volume in the upper lid. As you get older, you get hollowing in the upper lid, which this lady had. So with some fat grafting, facelift, fat grafting into the lower lid, you could see a real improvement. And I think she looks tremendously better, but natural and not terribly different to how she was before. Some more examples, and all these can be found on the website. And that's it for my part of the presentation. And I want to let you know, just because we are in our week of specials and we're announcing what the specials are. So what they are, I'm getting cued by Colleen, who's in the room right now, what our specials are for the week of September 28th to October 2nd. So you could call in at any time and book an appointment with me or pre-buy some things if you know you need them. But we're giving $100 off each syringe of filler, $3 off each unit of Botox. Typically people need anywhere from 30 to 60 units of Botox, so it could be a big savings. We're giving 25% off of all laser treatments, and now is the time to do laser. The summer is over. You've probably all done all sorts of damage to your skin, and here's the time to correct it. You could get yourself into a good treatment plan so we could reverse all those changes. And then we are also giving 20% off of all skincare products, so you could get into your home regimen, so you could really protect your investment and get into a really good habit of good skincare. So I think that's all I have. Do you have anything for me, Colleen?
We've run out of time. So what we're going to do, we had a number of questions. Thank you everyone for writing in and asking your questions. We're going to email you the answers to your questions since we've run out of time today.
Yeah, oh, sorry about that. I didn't see them pop up. But yeah, well, I'll get them in. I'll either do an Instagram Live and certainly get those answers out to you. And thank you so much for everybody who tuned in. I really look forward to hearing from you and hopefully seeing you in the office very soon. I'm trying to exit, but